This audiovisual program does not take the place of consulting the full prescribing information. You should read the IMPLANON package insert carefully before inserting or removing IMPLANON. All healthcare providers who perform insertions and/or removals of IMPLANON must receive thorough instruction and training through the Sharing Plow sponsored training program and, where appropriate, supervision prior to inserting or removing IMPLANON. The removal of a correctly inserted IMPLANON should be a simple and minimally invasive procedure. Because the removal of IMPLANON is a surgical procedure, patients should be fully counseled of the possible risks. The most common removal complications were with implants that were deep, not palpable, broken or damaged implants, difficult localization, slight migration, and formation of fibrosis. More detailed information is in the package insert. Advise your patient that to remove IMPLANON, a local anesthetic will be administered and a small incision will be made. IMPLANON will then be gently removed and the incision closed with a sterile bandage. After removal, slight pain and tenderness may be experienced. Be sure to explain that soon after removal of IMPLANON, your patient should restart contraception immediately if she still needs to prevent pregnancy. If she wishes to continue with IMPLANON, a new IMPLANON can be inserted at the same site directly after the first one is removed. Before initiating the removal procedure, the healthcare provider may consult the user card that is kept by the patient and/or the patient chart label. The arm in which IMPLANON is located should be indicated on the user card and the patient chart label. IMPLANON should have been inserted in the medial aspect of the upper non-dominant arm. Prior to removing IMPLANON, carefully read the instructions for removal. Find IMPLANON by palpation. If IMPLANON cannot be palpated, use either ultrasound with a high-frequency linear array transducer, 10 MHz or greater, or magnetic resonance imaging to localize the implant. Consider conducting difficult removals with ultrasound guidance. Only remove a non-palpable implant once the location of IMPLANON has been established. If these imaging methods fail, call 1-877-IMPLANON, 1-877-467-5266 for further instructions. There have been occasional reports of migration of the implant. Usually this involves minor movement relative to the original position. This may complicate localization of the implant by palpation, ultrasound, or magnetic resonance imaging, and removal may require a larger incision and more time. Exploratory surgery without knowledge of the exact location of the implant is strongly discouraged. Removal of deeply inserted implants should be conducted with caution in order to prevent damage to deeper neural or vascular structures in the arm and be performed by healthcare providers familiar with the anatomy of the arm. The patient's position for removal is similar to the position for insertion. Use aseptic technique. The following equipment is needed for removal: an examination table for the patient to lie on, sterile surgical drapes, talc-free sterile gloves, antiseptic solution, optional sterile marker, local anesthetic, needles, syringe, sterile scalpel, sterile forceps, straight and curved mosquito, skin closure, sterile gauze, adhesive bandage, and pressure bandages. IMPLANON must only be removed by a healthcare provider who has been instructed and trained in the IMPLANON removal technique. The arm in which IMPLANON is located should be indicated on the user card and the patient chart label. IMPLANON should be in the medial aspect of the upper non-dominant arm. After confirming that the patient does not have any allergies to the antiseptic, wash the patient's arm and apply an antiseptic. Locate IMPLANON by palpation and mark the end closest to the elbow, for example, with a sterile marker. After determining the absence of allergies to the anesthetic agent or related drugs, anesthetize the arm, for example with 0.5 to 1 cc 1% lidocaine at the site where the incision will be made, near the tip of IMPLANON that is closest to the elbow. Be sure to inject the local anesthetic under IMPLANON to keep the implant close to the skin surface. Make a 2 to 3 mm incision in the longitudinal direction of the arm at the tip of the implant closest to the elbow. Gently push IMPLANON toward the incision until the tip is visible. Grasp the implant with forceps, preferably curved mosquito forceps, and pull it out gently. If IMPLANON is encapsulated, make an incision into the tissue sheath and then remove IMPLANON with forceps. If the tip of the implant is still not visible after gently pushing it towards the incision, gently insert a forceps into the incision and grasp the implant. Turn the forceps around. With a second forceps, carefully dissect the tissue around IMPLANON and then remove IMPLANON. Be sure to remove the IMPLANON rod entirely. Confirm that the entire rod, which is 4 centimeters long, has been removed by measuring its length. After removing IMPLANON, close the incision with a butterfly closure and apply an adhesive bandage. Apply a pressure bandage with sterile gauze to minimize bruising. Explain that some pain, irritation, swelling, bruising, or tenderness may occur during the first few days. If any unusual symptoms or infection develop at the insertion site, she should return to be seen immediately. Here is another example demonstrating the removal procedure.